My spirit name, Ojibwe, is Firewoman. My white name, my English name is Carol Hernandez. I was first diagnosed with my cancer on July 1st of 2021. I had absolutely no symptoms. I was not surprised necessarily that I would have cancer at some point in time in my life, as both parents died from cancer at 67. And I have a nephew with terminal cancer, and my sister had cancer. So, we have a family history of cancer.
My name is Carrie Mooney, and I was diagnosed with cancer in March of this year. I started smoking when I was 10 years old. I'm 76 now.
Hello, I'm Faith Howie, 57 years old, and I've been smoking since I was 11. Oh my goodness. It's just been so hard. My mom, my grandma, my dad's brothers and sisters have all had lung cancer, and everyone has passed from it. A lot of my cousins now have it. And it's getting to be a normal thing to go to a funeral nowadays.
Hi, my name is Melissa Buffalo. I lost my father, Michael Stephen Buffalo, to lung cancer. My dad was a smoker, unfortunately. So was my mom. So the combination of both of them smoking in the home, in the car, and then my dad was a construction worker. So I can guess and assume that all of the materials he was around also played a role in his cancer journey. Losing a loved one, I think, is hard, and right? It's a whole journey. It's a whole healing process.
Well, I had a really bad cough. It started to really get painful. So I went to the emergency room. They took a picture of my lungs, an x-ray, and he said I had pneumonia, but he seen something else in my lungs, and he came back and said I had cancer, stage 3 lung cancer. I know I'm not going to be around for a long time, and I don't know if I'm going to really survive this. I have a hard time swallowing, where it's like I can't breathe, and it's like a plastic bag being put over my head and shutting me off. And so I have this machine that I inhale to try to break up that particle that's caught in my throat. And usually I can do it, but sometimes I couldn't do it, and we'd have to call the ambulance to get it out.
Hello, my name is Annie Rusk. I'm a physician specializing in pulmonary and critical care medicine and an enrolled member of the Blackfeet Nation. When I think about lung cancer and how it affects Native American people, it's kind of hard to see. There are fewer than 1% of our people who are screened for lung cancer annually. We're more likely to die from lung cancer than the general population. And even though lung cancer is decreasing worldwide and in the United States, it's actually increasing for Native American people. Lung cancer screening can help prevent or lead to early diagnosis of lung cancer. When we find lung cancer in stage 1 or 2, it is much more treatable than lung cancer diagnosed in a later stage.
My name is Sharon Anderson, and I had my lungs screened. What made me decide to get screened is I've got 4 children, and I want to be here as long as I can be here for them. And if I can catch something early, I would much rather do that. Really, the worst part about it for me is just the fact that the choices I've made, could have affected my lungs. And so, for many years, I thought I could stay healthy by, being active, doing cardio, going for walks, and still continue to smoke. And I think that's the scary part, is that my children would lose me, and I don't want that. So.
Oh, my grandkids, my kids, and my husband. I gotta be here to take care of everyone. My doctor had advised me to go get the lung screening. She thought it was best with my family history and that. So I went and got that done, and that's how you want to catch it, is at the earliest to fight it.
I am so blessed. I thank the Creator that I had a gallbladder attack, because mine, most early cancers, if not all, are found by accident. So I also think that Creator meant for me to find this. I have it, I found it, and I am taking treatment. And hopefully I'm kind of a good example to people to promote as best I can early lung cancer screenings. Your chances of survival are increased greatly the earlier you can diagnose your cancer.
When you show up to a lung cancer screening, you will probably only have the test done for 10 to 15 minutes, and it does not require fasting, so you can enjoy food the day of the procedure and immediately after. Lung cancer screening is conducted with a low-dose CT scan of the chest. It involves laying flat on a CT scanner. You may need to take off jewelry or other items. However, this test does usually not require anything invasive, such as an IV or injection of contrast.
I learned about lung screening from my doctor, just my regular doctor. I've gone in for an annual physical, and my doctor had mentioned, "Are you interested in having a lung screening?" And I was shocked that I had even qualified. I think all of us think we're younger than we really are these days. And so yes, I did decide to go ahead with that. The process of screening was fairly simple. It was handled like an X-ray procedure. So I came in, I put a gown on, I laid on the table, and it was really an in and out procedure. They bring you into the machine, you hold your breath, and then you come back out. And then they'll have you take a deep breath, hold your breath, and then they'll put you back in for a few seconds, and then they'll let you back out. And I think the process is like 3 or 4 times in and out of the machine. So yeah, it was very painless. I felt like, oh geez, why did I make such a big deal of this? This was so easy.
It's actually very easy. I'm somewhat claustrophobic. It sounds like a long time, but it goes fast. I was real nervous at first, but they have to where you can pick out an artist you like and they'll play your favorite music, and so I just closed my eyes and listened to my Johnny Cash.
The most difficult part of the whole process was waiting for the results. I couldn't believe how quickly I was out of the X-ray department, and the waiting was the worst. Yeah. The results of my screening were good. There was some collapsed villi, very, very minimal. Which I'm happy about. I'd rather not have any, but if that's where my baseline is, then that's where I'm at. But yeah, I'm very, very happy. I'd have the test performed twice now, and I will continue to have it done.
My doctor, she called me on the phone and goes, "I have your results." That whole night, I didn't sleep much, just worried, and she called and she goes, "We have great news. There is nothing there." She goes, "So you're lucky." She goes, "But every year, just come back and make sure you keep getting it done."
The best time to do screening is actually before you have any symptoms. You should have screening done even if you feel well and healthy. This can help lead to an earlier diagnosis of lung cancer that is very treatable and often requires a small procedure rather than long-term treatments. Lung cancer screening is very important for people who have used smoked tobacco products, including cigarettes, as this is the #1 cause of lung cancer in the United States. Your doctor may not be aware that you are eligible for lung cancer screening, and if you have a history of smoking, you should talk with your doctor about if you are eligible for lung cancer screening.
When I got to my oncologist, he said, I can possibly cure this cancer. And I thought, well, I mean, why would I wouldn't want to save my life? So I said, give me that shot, schedule that chemo, let's go. Would I do it again? Yes. I've been in remission, 2 years now in October. I feel confident in the decision I made. Lung screening saves lives, period.
I'm sleeping really good and not as fatigued or crabby at times. It's all really good now. For your peace of mind and for your families, you need to get it done. Otherwise, you're always going to have a little thing in the back of your head, wondering and worrying, and your family will worry. And once you get it done, you ain't got no more worries.
I think knowledge is power. I think it's easier to treat something that you know about than to let it sneak up on you. Go out and get your lungs scanned. Do it for your family and do it for yourself.
Cancer screenings do save lives. Do this for somebody you love. Do this for somebody you care about. Know that your cancer journey could be less in terms of being diagnosed at an earlier stage where you might have more options to treatment. You might be eligible for a clinical trial. Again, I think it just goes back to answering as many questions to the patient about what they're about to experience and how this is life-saving.
There is lung cancer screening out there. And actually my doc has just gone through that. And she has spots on her lungs. She has since quit smoking. So if you are in the eligible criteria, get it. It's painless. I think in most cases it's free. You owe it to yourself and your family to do that screening.
There are many barriers that may face our people in getting screened for lung cancer. They are more likely to have inadequate health insurance coverage or live far away from a screening facility. I understand there may also be mistrust of the medical health systems due to the atrocities committed against our people. I assure you, as a Native physician sitting before you today, things have improved. We are now here to serve the needs of our people, and there is a huge community of people committed to improving health outcomes for our people, including getting lung cancer screening done for people who need it. Most lung cancer screening evaluations are covered by insurance. However, if you are uninsured or underinsured, we recommend talking to your local healthcare provider about how you can qualify for lung cancer screening. When I think about my own family, my grandfather died from emphysema because he was a lifelong smoker. It's really important to me to help people quit smoking because it's really the first step we can do to help our people improve lung health outcomes.
I can remember at the funeral, when we had the funeral for my dad, the pastor had said, if you live to 72, you've lived a good life. And my dad was 71. And so to think about, right, I want to be healthier for my kids because I want to have a longer life. And so not being a smoker, not being someone that drinks all the time, how can I live a better life? Because that's what my parents would want. Losing my dad has been difficult, as anyone can imagine or has experienced, but being able to live in a good way for him and to be able to just do our best to remember him and all of the memories
The fact that I smoked around my kids when they were babies is the hardest thing I deal with because it wasn't their choice. You know, and you do have to take responsibility on your choices you make in life. I'm in a group, it's called the Grandma's Group, and half those women smoke. The group is like 2 hours, and they want to go and have their cigarette break. And I tell them my story, you know, that it's not easy, you know, to deal with this, because you can deal with it, but your family, your loved ones can't deal with it.
If you are a current smoker, ask your doctor about ways to quit smoking. There are medications, patches, gums, and even inhalers to use to help you quit smoking. Your lung cancer risk decreases every year after you quit smoking. However, it is important to continue screening until directed otherwise by your lung cancer screening team.
Other lung cancer patients, which I do know a few, and actually just we here at the place where I live just lost a resident due to lung cancer. She never talked about it. I think there's shame attached to lung cancer. You did it to yourself because you smoked. Well, you didn't quit, you didn't do this. Hogwash. You know, we didn't do this to ourselves. Maybe we played a little part our lifestyle, but same with other conditions. But don't be afraid to say, I have lung cancer. And, you know, hopefully you have a friend or two you can call up and say, gosh, I'm just having a down day.
To learn more about
Screening and early detection.
Please visit abreathofhope.org.
If you're over 50,
And you're a smoker,
or a former smoker,
Please visit mnscreens.org.
And take the quiz.
Nitsi Taki, I'm grateful. Together, I believe we can improve lung cancer screening outcomes for our people.
don't hesitate. You need to go in there, get it done for you, for your family, your loved ones, because if you don't, what could end up happening, no one would like.